When a surgeon says the words, "you need surgery," it really has a different definition today than it did 5 or 10 years ago.
I remember a time when a patient was in the hospital for over a week for even the simplest spinal procedure. Now that patient would go home within 6 to 8 hours.
Today, there really is a minimally invasive revolution going on where more and more is being done in the outpatient setting. What that means is that patients can be done in the surgery center space. They don't necessarily have to be admitted to the hospital.
Sometimes surgery is the safest, most conservative, least invasive thing to do. That's what we're trying to do with our expert care at NSG, is to show someone both diagnostically and prescriptively how quickly they could go back to their optimal state of recovery with the least invasive intervention possible. And same-day surgery for both cervical, which is neck artificial discs, and lower back discs has become routine for us.
Dr. Vokshoor brought up the artificial disc. And the artificial disc is really a device. It's this bionic device that is designed to replace a diseased disc that we would surgically remove, and it takes its place, but it takes its place in a very unique way. It's designed to mimic the normal and natural biomechanics of the spine. The spine is made up of motion segments. We're not fusing a segment together. We put in a device that moves like your natural disc, so you can potentially leave the same day after surgery, go back to work, and go back to your activities faster.
So just to build on that, a couple of nuances about artificial disc technology is that the expert neurosurgeons realize the difference between the kinematics of each disc and the kinematics of the spinal motion segments that a patient brings. In simpler terms, every spinal motion segment moves a little differently. Therefore, the characteristics of the bionic shock absorbing device that we're trying to replace the native disc with has to match that person's stiffness characteristics the best. As we age, certain spinal discs get more stiff than others.
It's not a one-size-fit-all answer, and that's what's really important is the patients need to be informed. Give us a call and let us help make that assessment. Different discs, different devices are suited for different patients, and we often are talking to each other, trying to figure out the best way to restore a patient's normal anatomy. For us, it's really about restoration, restorative health, to get you back to doing what you love to do. Most often, these surgeries are not about life or death. It's really about quality of life. And our job and our goal at NSG is to give you the best quality of life possible. And we both strongly believe that one of the best ways to do that is using artificial disc technology. Very often in an outpatient setting, you go home in a couple hours and you're feeling better.